gonna start funky. So Dr. Robbie just introduced herself. Nikki, do you mind introducing yourself?
I don't mind. I'm Nikki Jardina. I'm a public health nurse. I'm the syndemic nursing supervisor at NACC.
Good. And I'm Lindsay King-Cooney. I'm the harm reduction supervisor at NACC and the facilitator of this ECHO. So we'll just do some quick announcements. I'm going to share my screen and then we'll get started with the presentation. All right, so welcome again to the Midwest Tribal ECHO Opioid Use Disorder Education and Treatment Series. Today, we are very excited to welcome Aegor and Dee, who are from the Sex Workers in Minneapolis organization, or SWIM. A little bit about NACC if you're not familiar. So we are an FQHC that was established in 2003. We're located in the heart of the urban indigenous community on Franklin Avenue. This is a list on this slide of all the services that we provide. And then we have our website at the bottom. If you'd like to learn more about us, please feel free to go to the website. This is a list of our updated current open positions at NACC. Website again is at the bottom of the slide. So if you go to the website, just click on the job section and you can read more about these openings. Some session guidelines, please know protected health information. We love to see your faces. So if you're willing and able to turn your cameras on today, please do. We invite you to use the chat to ask questions or if you have any comments, and then we'll probably save discussion for the end. And then this is a list of other ECHOs that cover similar topiks to us, Hennepin Healthcare, Indian Country ECHO, and Stratus Health. So if you'd like any more information, I'm happy to send that your way. And then some other announcements. So we will not have a session the week of July 2nd due to the holiday, but the next session after that, I believe it'll be in 2 weeks after that. And we have our traditional healing team that will be on to talk about their program. That's going to be July 16th. And then finally, case presentations. My email is on this slide in blue. Feel free to email me if you have a case presentation that you'd like to present. They make for a great discussion, so they're definitely welcome. All right, I'm going to stop sharing. I'm going to hand it over to Aegor and Dee. Welcome. Thanks for being here.
Hello. Thank you so much for having us.
Yes, we are so excited to be here.
Yeah, I'm Aegor. I use he, him pronouns. And I organize with the at SWIM Sex Workers in Minneapolis. We are a small grassroots collective, primarily committed to the full decriminalization of sex work in our city and in our state. And then I'll pass to Dee to also, maybe add on some more.
Yeah, I'm Dee Fox. I've been organizing for sex worker rights in Minneapolis for over 5 years now. All of that time has been with Aegor. And this presentation, I know some of you have seen, but we are so excited to be here and talk about this. And there will be time for like discussion at the end. And I always like to tell people that I don't mind being interrupted as somebody who's presenting. So if you do want to chime in at any point within the chat, or just using your voice, that's totally fine for me. And there are a lot of people here, so are we going like around the room to introduce? Or should we just get right into the presentation?
I think people are sharing in the chat.
Oh, perfect.
Yeah. And then additionally, we would love to share our contact information to continue to be in relationship after this presentation. But I'll go ahead and share that right now.
Yeah, I included my contact info for sure, because I haven't always been, but right now I have a lot of capacity to like in real time actively respond to folks. So yeah, I want everyone to be able to feel like we are accessible far beyond this one little hour that we have.
Sweet. So this is our presentation moment. And this is what we're planning on talking about today. I'm sure like many of you have familiarity with commercial sex work in the fields you work in. But we're gonna kind of create a definition together, or at least share the definition that we use in our organizing. We'll talk through systemic barriers that people within commercial sex face. We'll talk about whorephobia as a specific anti-sex work form of stigmatization. We'll go through the legal models. We'll get into conflation, and conflation specifically speaks to the conflation of sex work and sex trafficking, and why it's important to sort of disentangle those things and also understand how they overlap from like a human-centered perspective. What matters and what doesn't matter when working with a sex worker, and then what would decrim look like. This is like a very juicy agenda, so I hope we get to like most of it. But additionally, yeah, feel free to like interrupt us with questions or discussion points.
Yeah, and Igor and I think we organize in a way that we want to build like power and confidence through literacy campaign in a way. And we do definitely see this as a way of like giving you language that can be used to not only like help our or like support our movement, but also impact like the daily lives that you have with the people that you're serving.
Mhm.
So I can get into this. So I think it's important to recognize that sex workers and sex work does not exist in a monolith. And there are lots of different reasons why people choose sex work. And there are different types of sex work that is being chosen. And also within that chosen, there is a bunch of choice and consent that is present in sex work. And so some of the reasons that people might choose sex work is just for survival, money, very basic reasons for anybody else to get to work, needs and goods, housing, disability, accessibility to other traditional or conventional employment might be inaccessible. And there's a flexibility for parents, students, people who might have otherwise like day obligations, caretakers, so they can work at different times of the day. They might choose sex work because they enjoy it, but it's really important to just hound in that it's the same reasons that anybody would choose any other form of labor. And I like to think about it in spectrums when I think about all the different kinds of sex work. And it's important to like, we'll get into this, that there are some forms of sex work that don't have any laws about them. And then there are some forms that have a lot of laws around them. But sex work can be physical contact or no contact at all. Some sex workers are having sex with their clients. Others are not having any physical contact whatsoever. Some workers are working inside, some are outside. Sex work exists on the internet. It exists in person. It might be filmed. It might not be filmed. It might be live or not live. So it really exists in all sorts of different ways. And the types of choices that are really important for when folks are doing this labor is what kind of work they're doing, the boundaries of within that. I just heard too, like there's just so much dignity and risk. And I think that's really important to think here too, is that these boundaries are going to look different for everybody. And it's important for folks to have like the leeway and the access to do their client screening and set their own rates, be able to work where they want to work, when they want to work, and who they decide to work with. Would you want to add anything, Igor? No?
No, I feel like yeah, I love the comprehensive model. And I think we'll get to this like later in the presentation, but um, sex work is like such a large umbrella that, as Dee pointed out, contains such a spectrum of kind of work, like realm of consent, spaces that people work in. And so we're trying to be really careful to have both a broad understanding of it and also then follow the lead of like whatever the client is choosing to identify as. So some people who may participate in trading for sex may not identify as a sex worker. And then at that point, it's like use the language that they're using for themselves. But I think we get to that a little bit later too. Um, I'll get into some systemic barriers, of which there are plenty. But these are barriers why sex workers may not seek care or resources. The largest one that we identify is criminalization. Um, and so, as Dee stated, like criminalization affects different sectors of sex work differently. And so, the greatest burden of criminalization is faced by people who are working in public, people who are working in person, people who otherwise experience different kinds of precarity, poverty, maybe have been shut down by systems in many other ways. And then all of those things and just the like participating in sex work and also even being in community with sex workers leads to surveillance. And so sex workers experience surveillance um, on the internet, in person, within systems. And even if maybe the surveillance isn't happening actively, the threat of surveillance and criminalization is so intense that it really is limiting for people to seek services. Incarceration, for sure. And what a history of incarceration or criminalization due to sex work like then does to someone's future opportunities is very limiting. Lack of safety, which we would name as like basically all of the things that I just named contribute to lack of safety. And so our standpoint is that sex work is not inherently unsafe, um, nor should it be. And so our organizing is basically like, how can we uh, reduce the real risks that people face as much as possible? But we know that, for example, the threat of criminalization leads to people like not being able to name the violence they experience. And so it's like the violence they're experiencing is not inherent to the labor, but their inability to actually seek resources because they're afraid of being incarcerated. That in itself is like its own kind of barrier. And then, yeah, to that end, also difficulty seeking justice. Yeah, we know in Minneapolis, uh, even pretty recently, I'm pretty sure, Dee, that like there's street-based sex workers who have been told by police officers that they were not able to take their claims of sexual violence because they are sex workers. So even when sex workers choose to seek legal resources in like the exact paradigms like dictated by the state, they're denied because of their relationship to sex work. So
Yeah, and the stigma is just embedded in those systems. And if and honestly, like to a point where if there's such a lack of literacy there that people are either identified as a criminal or a victim. And a lot of the times the victim is also the survivor is also criminalized. So yeah. I liked it. So most people we usually run into folks not being super familiar with whorephobia. So the next two slides, like the next thing is about whorephobia and the whorearchy. And this is just like, because I think it's hard to like get a definition of it, but we are all exposed to whorephobia and it's weaved into our daily lives. And a lot of like what we were just talking about is happening because of whorephobia and the stigma that like it feeds into. It feeds into this like because like there's an internalized sense of whorephobia where I think sex workers are kind of scapegoated as the result of such lack of sex education and comprehensive consent education. And so this fear that sex workers are kind of this like, well, there's just this only way to be a sex worker. And there's this identity that's placed on it that doesn't work or like at all reflect the lived reality of people who have survived the burden of criminalization. And so that fear impacts the access to equitable housing and healthcare and then just liberty. And I just like to note that like folks who are like sex positive in a way, or at least have education on consent and comprehensive sex education, there's like this element where like they are not as hard to like convince, I suppose, of decrim, and like these are like just regular good old-fashioned bodily autonomy rights. And so like attitudes around sex are absolutely shaping the attitudes around whorephobia and the way that we criminalize people who do this labor. And that's like, okay, I'll step off my soapbox, but that's my take on whorephobia.
I love your soapbox. I feel like, okay,
Thanks.
one thing that you've said that I think is really helpful for me in terms of understanding scapegoating specifically, and I think would be interesting for this group, as many of you work within public health, is that, and Dee, just correct me about like dates and times, but um, at the advent of like penicillin in Minneapolis, there were reports from, was it the public health commissioner at the time?
Yep, it was the county health commissioner.
The county health commissioner said, wrote something stating that like, oh, now that penicillin is like released to the community, like all of the whores are gonna go out and just get sick and then come back and get their and so it's like you can see in that sentiment this pervasive attitude that like the sex worker is the site of disease and should be punished for their labor rather than like our society shouldn't fail. Like if we have the means and the ability to keep people from getting sick, we should do as much as we can, instead of assuming that uh, access to preventative measures is then going to lead to like behaviors that people deem as immoral. And like we've seen that we see that with PrEP, we see that with like DoxyPep now. And so we would say that that's rooted in a whorephobic sentiment.
Yes. And we definitely see it in the harm reduction world for sure. And the way I see it is like, wow, they're really using medicine as a tool against us in a way. Like it's weird.
Mhm.
And medicine as a tool of vice, which I think is really convenient for them, I suppose. But Igor, I think you should do this one.
Oh yeah, yeah. So this slide is talking through the hierarchy. There's a couple different diagrams of it. Um, the hierarchy is basically a way of understanding intersectional stigma within how society treats sexualized labor. And so basically you can see in these different pyramids that like if a sex worker is doing in-person versus online work or like non work that doesn't involve touch, if the sex worker is working inside or outside, how much people charge, and then all of these things are made more complex by race and ethnicity, by people's yeah, like whether they're documented, undocumented, how they perform a certain ideal of gender or like a certain kind of like respectable kind of beauty. Yeah, and you've probably seen this in different ways. I feel like this comes up just in, like cheap jokes people make. But additionally, like something that I think really illustrates the hierarchy is in New York City, when they repealed loitering with intent to commit prostitution, the law was used in such a stigmatizing way that it was known as walking while trans. And so, like, an overwhelming amount of trans women of color, specifically Black trans women, were charged with loitering with intent to commit prostitution because of the way that they are labeled as sex workers just by their appearance, where they are, who they're affiliating with. And if you break down even that kind of law, like loitering with intent to commit prostitution, any kind of like intent law is left up to officer bias. And so that's just a way that like we're trying to illustrate that like stigma is so pervasive and then has like real material ramifications on people. Zoom is hard because it's hard to tell if this is like tracking for people. So feel free to jump in at any point if you'd like to. Yeah.
And I would like to like this, the hierarchy is also, I think, something that people, so we call our decrim campaign No More Dead Canaries. And there's a whole reason that we say canaries is because we have been kind of on the front lines of things like criminalization, surveillance. And we have been speaking about things that we know will eventually reach people who are outside of the sex working community. And we just did a big workshop with therapists. And it's interesting how like what our feedback is that like sex therapists, sex educators, are actually really really feel the impact of the hierarchy as well and feel, yeah. So like it just spans, like we all are impacted by this.
Mm.
That's the only thing I would add.
Oh, pause for
Oh,
questions.
perfect. I thought about this.
Yeah, we're open to questions and also like, any comments if you've noticed, yeah, just the ways that hierarchy and sex worker based stigma like affects your job or your clients.
What I've noticed is when I worked for the Needle Exchange, there was a lot of conflict and stigmas to certain wording, even as far as the substances they were using. Like there's a hierarchy even with the substance abuse. And the biggest thing is those that are, I guess you could say, at that lower totem are more ashamed and afraid to share certain things that they're doing, because some of them are more or less, in my experience, new to the sex trade, because it's substance that brought them to it. I would say that it's very much hand in hand with the substance abuse, at least what I'm seeing. And we're dealing with a lot of additional addictions into sex because of the substance. Would you guys say the same for down south? Because at least for Duluth, that's what we're seeing. So I guess I don't really have a question, just more or less sharing what I've experienced out here in the Duluth, St. Louis area.
Yeah, I think there's there's a huge, I don't think that harm reduction would even exist or be understood the way that we do if it weren't for sex workers. And there's this like harm reduction element that comes in where we know what's happening and it's about making sure that people have what they need and how do we create the space of which people feel like they can actually ask for what they need. Yeah. And I think also there's like, this also makes me think of intake questions, which we might get into later as well. But I think that's also a way, like when we think about people who like, not everybody who is in the who is trading sex would like identify themselves as a sex worker or somebody who because this is where choice gets gray. And I think what the law does is it doesn't allow for that grayness to come in and meet the needs of people, especially at the level that like our values actually demand.
Mm.
And I just think about the possibilities that decrim can open up for.
Mm-hmm.
Could you guys elaborate more on what you mean by the statement or slogan, no more dead canaries?
Oh my God.
Yeah. Yeah. Um, yeah, we can share a bit about it. So, over and over again, we see or interpret sex workers as kind of like the metaphorical canary in the coal mine. So, like a community that is scapegoated, that you know, lawmakers decide to do things in the name of our safety that end up actually being like really um, unsupportive, extremely unsafe. And the reason why we say canaries in the coal mine is that we've seen time and time again that um, laws that affect and stigmatize sex workers soon affect the general population. An example I could say of this is Fosta Sesta of, I believe, 2017. And so these are two bipartisan passed bills, Fight Online Sex Trafficking Act, and I forget what SESTA stands for. But basically, in 2017, these laws held internet service providers liable for anything on their websites that was seen to promote commercial sex in the name of ending trafficking. And what this ended up doing is that it criminalizes sex workers who are posting bad date lists and sharing that with each other. It criminalizes people being able to advertise services online, which is so much safer than being able to than having to do that on the street. So, in the name of preventing trafficking without the input of affected communities, it then shut down the ways that sex workers were, in fact, keeping each other and themselves safe. And the larger ramifications for that for the wider population is like the internet in the last few years has become more puritanical. And so it like uh, we might think that things that are affecting sex workers won't affect all of us, but because sex is a part of human life broadly, the ramifications then end up being felt by everyone. Dee, did you want to jump in?
I mean, yeah, I could talk about this for a long time. If you Google sex workers and canaries, like there's a lot. I mean, there's like a few writers out there who have a lot of work out there, but it's definitely a thing that sex workers feel. Um, and I also want to say, like, right, like the new porn laws that we're seeing, like all of that is built off of that, like idea. And I think when you take away so when you take away the internet, which is something that we like a tool for safety, there's another place too that like so it now becomes illegal to advertise on any website that's owned by a company that's in the United States, which then people will go and post on other websites that aren't. And now we don't, but like having your information on a website from a different, there's like stuff gets stolen and you don't have rights to get information removed. And now you're into this whole like this new world of online harassment and online violence and abuse. So it digs deeper into this violent space within the internet even as well.
Mhm.
Yeah.
And this does tie into what we're about to get into, which is kind of like the issues of conflation. So like on this slide, we see no matter how the law is written or what other people might say, sex work is not sex trafficking. Um, so we want to be very clear that sex trafficking is real. We would never be people who say that it doesn't exist. However, we've seen over and over again that um, that there's a saviorism involved in stopping sex trafficking that has really intense ramifications for sex workers. And also people who have been trafficked and people who do sex work. There are overlaps, which I think Dee, yeah, has listed here.
Yeah, you can kind of exist within the world of sex work and sex trafficking in all of the possible ways that they exist. Um, and we like to make it clear that like when we are saying sex work, we are talking about somebody who's choosing to do it. or at least just practicing sex work. But once this, so like people who are choosing sex work may have also survived situations of exploitation and trafficking. And at the same time, people who have experienced exploitation and trafficking may have never chosen sex work. And some people who choose sex work, or some people choose sex work after or before a trafficking or exploitation situation. And people who choose sex work may have never experienced any sort of trafficking or exploitation within that industry. And what we would like to just push is that the importance of never assigning victimhood and always protecting consent and choice, because at the end of the day, like, I don't know, like, I'm not interested in having like an analyst on like I don't know, like, this is where people get lost in the weeds, I think. And it's important to just land in people's choice and agency.
Yeah, there's a question in the chat that I think you sort of just answered in some ways, but it's how is the approach different for people actively defined as sex workers and someone who's shown signs of sex trafficking if they aren't openly disclosing that definition? Um, I guess this is where we fall in the line of like allowing people to name their own experiences.
Right.
And so we're not trying to create a spectrum where all sex work is completely free choice. People are like choosing to do it with like open agency, and that's the only reason they would. Obviously, like we live under conditions of capitalism, colonialism, forces of coercion, you know? Um, but in the same way that we could understand that like the lived experience of somebody who may work at a fast food restaurant is very different from somebody who is like a career server at a formal restaurant. We're just trying to have that same spectrum of uh, understanding for somebody who might be in the sex trade. And so um, I think like to answer that question, I think that like the best we can do is create the conditions and work on our own internalized biases and practice relationship with the person in order for them to feel most comfortable, like naming the sources of coercion or exploitation in their own life. And Dee says this all the time that like people save themselves. And I think many of you have probably experienced that in your lines of work. Um, but I think that like yeah, like laws, specifically laws that criminalize sex workers' ability to convene with each other, actively prevent sex workers from like getting to know each other, getting to know the ins and outs of each other's lives. And like that's really how people find safety is like you interact with somebody over time, and then one day you feel the ability to say, like, hey, this like terrible thing happened, or like I feel confused about this interaction. I hope that made sense.
So the legal, I mean, the legal models have honestly, we've been talking about this for, 6 years. And I think it has only just gotten more confusing because there has been movement, like sex workers are loud all over the globe. Like there's news coming out all the time. And I don't know, we do our best, but like, so there's 3 categories that we have come up with, I suppose, in our movement of understanding the legal approaches to sex work. Criminalizing is usually when we see criminalization, which is most of the policy of the land, it is including everybody involved, which is the seller and buyer. And it can also include third parties like landlords, advertisers, bookkeepers, anything like that. This is the highest interaction that workers have with violence. And then we get into legalization, which is this is where things get a little confusing. So what has been traditionally known as the Nordic models, and they have been recently renamed equity models. These are what, like there's a partial decrim idea where it's like, yes, it's legal to sell sex, but it's not legal to buy it. And a lot of times then if you are not choosing to criminalize the purchasing part and you're legalizing the whole thing, what happens is we get the state ends up holding the bucket of violence and is the ultimate decider of how this work happens. But so even within the legalization, there's like different ways to think about it, which we can get more into if there's questions. But then we have decrim, which is what we are advocates for, which is, and we can go into more depth of what our movement looks like, which is the No More Dead Canaries campaign. But in that sense, nothing happens when somebody sells or buys sexual services with consent. It's just like nothing happens. We're just taking a walk in the park. Nobody cares. Trafficking and exploitation remain a crime. And in decrim, what studies have shown, like we have empirical data for this, and this is where we see the lowest interaction with violence, both from the state, because the state is also one of the biggest categories of violence against our community. And then up next is our clients. And so with decriminalization, opening up more resources and accessibility to healthcare, housing, financial independence, you're going to see the lowest interaction with violence. I went through that.
That was so good. Under legalization, I guess I'll also add that like legalization also includes like the legal brothel model that exists in Nevada right now. And I guess I just want to be very clear. I mean, I think many of you in this room have some familiarity with this, that like we are pro decriminalization and anti-legalization, primarily because legalization comes with regulations that never tend to be named by or towards like the safety of sex workers. In some ways, we see legalization models as like the state becoming a pimp in some ways. We see that legalization models across the world often come with highly stigmatizing forms of social control or like medical testing. And so like that, there's like many reasons why we oppose the legalization model. One that Dee named really clearly is like the state has had a hostile relationship towards us, so we don't trust them. And then secondly, like legalization doesn't suddenly end stigma. And so, uh, though something might suddenly be legal, if it comes with regulations of how a person is supposed to do that labor, it then creates a new hierarchy of like what it means to be a second-class citizen in a specific way. Yeah, I hope that made sense.
And we do have, in Minnesota, we have the safe harbor law, which means that anybody under the age of 24 will not ever be charged. And like the crime is prostitution. And you might have noticed that we haven't even like used that word yet because it is criminal language and that's how we see it. Nobody in the state of Minnesota under the age of 24 will be charged with that. However, there is such a way that the policy is written is that there is, and what we have heard too from feedback is that the assigning of victimhood, even when somebody might not feel that way, doesn't lead to like the desired outcomes for the people that end up getting within this system. So that would be like how we have a version, a tiny little version of partial decrim. However, it comes with a lot like this huge net that we're not always sure is giving people always what they need. And we have like the no wrong door policy as well, I think, across Hennepin County, where nobody, if they report violence, sexual violence in any context within the hospital setting, is like they can rest assured that like they won't. I don't know how that actually plays out, but there are these policies that can kind of come in to soften the blow of criminalization, but they're not ultimately like, they're not everything. I see things coming through the chat.
Yeah, Mickey posted, like, I feel that legalization would be putting a new layer of stigma on sex services and may even heighten violence. Definitely agree with that.
And that does ring true in Vegas. Like they don't have good results. Yeah.
Additionally, like another kind of way to think about how legalization puts people at more risk is so the Nordic model is named that way because it is primarily happening in like Sweden, Norway, Finland. And you know, it gets this really like uh it gets all this like press or sort of like it's seen as like a less violent model. Um, Purchasing is penalized, but selling is not. However, what happens is because there is still interaction with law enforcement, it leads to people who are at great risk of harm from the law. Like you're still in risk. So people who are undocumented, migrant workers still get deported under the Nordic model because they still have to interact with the police. So we don't really see it as protective, and we do see it as like additionally stigmatizing.
And we know that sex workers are targeted for this very reason, is
Mhm.
because violent people know that they're just people won't care.
Mhm.
This is a very busy slide,
Yeah, and I feel like we, you
and
know,
we covered a lot of it.
we covered a lot of it, and there's also, yeah, like we would totally urge you to continue to like do your research and thinking, and also like reach out to us. I think we'll send like a little bit of a reading list after this. But yeah, in conflation, this is how we consider the way that the law considers sex work and sex trafficking as like the same thing. So we want to be clear that exploitation is the use of coercion, force, theft, or manipulation to get people to participate in commercial sex trades. Sex trafficking is specifically the containment of movement of the containment of and movement of people into the commercial sex industry. Um, and yeah, like we know that labor trafficking exists in many different industries, including fisheries, agricultural labor, um, and sex trafficking, in our opinion and kind of in the way that we see it play out, is really overdetermined as like the only site of exploitative labor. And we know that that's just like not true. Um, Additionally, I mean, this is kind of like my soapbox thing, but I always want to bring up that the origin of anti-trafficking law in this country specifically comes from like a xenophobic root. So it's what the 1910 Mann Act was specifically passed to prevent foreign men from bringing white women across state lines for debaucherous purposes. And it was specifically targeting, I believe, Chinese immigrants at the time. And there was like a global movement. There was a Paris meeting around like ending the White Slave Traffic Act. Um, all of this, as we know, is happening after the abolition of slavery globally and in this country. So it's like there are all these ways that the way sex trafficking is talked about, who people are claiming it happens to, who is the villain in the situation. I guess we just like urge everyone to be like really thoughtful and careful when you're seeing that messaging, because so often it plays into xenophobic, white supremacist roots.
Yep. And even I like that timeline too, because like so most all red light districts in the country were closed, not like within 10 years of that happening. And that's like when Storyville was like kind of the last big one that closed in 1917. Very
Mhm.
coincides with the war as well. So
Mhm.
there's a lot of historical like racism in integrated into this.
Yeah, and so I think that like in terms of uh how do we disentangle this conflation? So like we believe that like with the decriminalization of sex work, and this is also evidence-based, with the decriminalization of sex work, um, people who are engaging in any kind of commercial sex could name the elements of force, fraud, and coercion in their own lives and seek support from other people who actively understand them instead of maybe the state or like a law enforcement officer who's essentially committed to not understanding them. So we feel that like trafficking will still remain a crime. And with sex work being decriminalized, people will have more roots to actually like, yeah, like create safe labor conditions for themselves.
Yeah. And so like just big takeaway thing, like take this away and do with what it makes sense to you. But like the things that we think that matter when we are working with sex workers in like a service setting, the language that we use matters. And that was kind of already brought up. Just using language that people are using themselves to identify themselves with. Privacy matters. The questions on forms and registrations and just in the way that we like communicate with our providers is important. There's this little thing called mandated reporting that gets in the way of so many things. So like that is also like a power dynamic, like the power dynamic that is created between a service provider and somebody who is performing criminalized labor, like I just think needs to be addressed. Inclusion matters. So like sometimes we just think of like we have icons, we have our legends, having posters with our slogans can be really simple. If you have a bookshelf, having books that might be familiar with like titles that are pro sex work to show that you've done the studying. I think acknowledgement of mistakes and your account and having accountability matter when we do make those mistakes. And anytime that we can like help people embody their choice, their consent, and autonomy, that really matters.
And then what doesn't matter? And yeah, we have the caveat that like these things still matter, but we don't need to get lost in the weeds, especially when we're working with somebody. So yeah, why somebody chooses sex work um, is value neutral. Um, that's just kind of, yeah, like any reason for choosing rec sex work is a fine reason. And we don't need to like over determine like you're doing it to go to school versus like you're doing it to like buy your drug of choice. Like we don't need to have a moral judgment on that. Um, your personal opinions about sex work don't really matter. And so for this, like we really suggest like working through your own biases. Um, I think sometimes like in larger groups, like I find it really helpful to just bring up like a lot of our stigmatizing thoughts about sex work are because we've been told from a very young age that it's icky. Like we've lit like that's just, you know, like we've been told that it's not respectable, that sex workers aren't leaders in their communities. And so like really going into your own biases and considering them will like actively change your somatic presence with a sex worker. And then, yeah, your concern of safety doesn't matter if you're not able to do anything. And so that's just like to bring up that, yeah, as many of you probably know, like your assumption of what risk is for somebody may not be theirs, and they may not want you to bring that up unless you're like, actually like you know if you're like how are you getting home and then you're able to get them a ride, that's so different from like bringing up that you're concerned and then sort of leaving them hanging.
Yes. And I think folks do get this a lot.
Yeah.
And there's also like, I'm surprised we haven't mentioned this yet, but I also think that sex work, it gets scapegoated a lot for things and it also gets pathologized as things as well. That like, oh gosh, all people's problems can lead all back to their choice of sex work. And I think Aegor has also like gone public sharing a lot of times on how welcoming it feels for somebody to just, you know, in a therapy setting of just like that neutrality. And it's like, well, is this a concern for you? And having the voice to choose on deciding if this is an issue and not assigning that pathology to it. Sorry
Yeah.
for speaking your story, but
No, that's so helpful. But I'll state it. This was I feel it tends to be impactful with providers. But yeah, my therapist who I've been working with now for 5 years, I like a couple of years in, I brought up that I had experience in sex work, and he was like, "Is there anything you want to process with that?" And I said no, and he was like, "Cool." And then years later, when I did want to, I like felt so much trust because I knew that he wasn't going to like he didn't have a story about my experience before I said it, you know, and like it was my choice when I wanted to talk about it or not. And so just that like availability to like let someone determine when, how, when and how they want to talk about their experience, I think goes a long way to build a relationship. Uh,
We are kind of, well, yeah, 10 minutes left. If people have questions.
yeah, we're open for any questions or comments too.
Aegor, do I see a comment that just went into the chat from Karen? Thank you for sharing your wisdom. I wonder if a universal screener similar to Q's would be useful to our community. Not familiar.
What is cues?
I don't know what it is. Oh, yeah, I do.
Oh, CEUs. I'm
Got
not
it.
sure I know what that is, but
I think like what type of screeners what I think feel right are screeners of safety, which already exist. Like in like every time I go to the doctor, I am asked if I feel safe at home and at work. I think they're like it's just that same. It's within that breadth. Like I think it's fair to come up with sexual safety screenings, and I also think that there's a way to screen for people's like comprehension of boundaries. I don't know. Like it just is like there's so many different ways that we can approach this but for me I think it's really about making sure that somebody like is connected to their own sense of self and agency
hmm.
and to make sure that they're like making choices that they're like fully.
I
If
think
that makes sense.
something that we brought up in the meeting we had with
Oh,
like primarily healthcare professionals was like if you have the opportunity, like sharing information rather than like pigeonholing somebody into a certain flowchart model. Like just because you know somebody's demographics doesn't mean you know what's going on in their lives truly. Versus like, I'm trying to think of an example, but like if you are doing any kind of like STI testing, and if you were to say like there's a chlamydia outbreak, these are the ways that people contract chlamydia, like would you like a test? That's a very different question than like how many sexual partners do you have? You like, and then hearing that answer, like you should get a test. Because the thing is that when you ask somebody how many sexual partners they have, you're not actually asking them like the questions that are important for disease contraction. You are in a certain way, but like as we've explained, like somebody who's a sex worker may identify as having so many sexual partners and never have penetrative sex, never do skin to skin contact. You know what I mean? So it's like if you bring up the risk factor first and then allow someone to self-identify, it may be more of a conversation, but it, I think, leads to building more relationship. And then also you're empowering your client with like their own knowledge so that they can, if they have an experience where they're like likely to be worried about chlamydia, they can bring that up themselves. Um, I hope that makes sense. Cool. And yeah, I think that that's tying into what Karen's putting in the chat, which is the Q's emphasis is providing resources and not asking people to share stories to get resources. I appreciate that.
that's big. And a lot of like those sexual health questionnaires are assuming that people have like what we would understand as like a traditional relationship, which is just like, I mean, those forms are very intimidating. And I think from the get-go is like to think that a form would stop somebody from seeking healthcare, but I mean, it happens. I think that's very real to
Mhm.
consider.
We have
Yes.
5 minutes, so we're going to get into our campaign a little bit. Yeah.
Yeah, this was just like a little plug-in in case we had time, but I do think it's important to like just be really clear that like what we're doing as sex worker organizers is that like we're pushing for an anti-violence like world with equitable access and community power with the full recognition of rights in labor, bodily autonomy, and sex. We're not expansionists, but we're also not trying to like abolish the industry. We fully recognize that it is here and it is here to stay, and the people who are in it have rights. And we do use, I guess it's like a hot word, but sanctuary. We believe that a sanctuary state is possible. And so the next couple of slides will just get us through those on what does it actually look like? These are just more cute little canaries. Okay. So in a sanctuary state, the exchange of sexual services for something of value is not a crime. There are no resources used to regulate or interfere with sexual activity between consenting adults. Sex workers and their clients do not fear arrest, unfair treatment from justice or safety systems, or any form of punishment from the government. And sexual and reproductive health care is readily accessible for anybody who asks for it. And I think even here, you can already kind of see how like the overlapping of other movements is starting to come in. Exploitation and trafficking remain a crime. Resources are focused on preventing sexual violence across the whole world, increasing healthcare access and providing education. Pathways to report violence and exploitation are accessible, reliable, and trusted by the community. So like there has to be an effort from that state side and the community service side also. The expungement of previous convictions and reparations are given to community members who have been impacted by unfair treatment, which is actually a little bit kind of happening with the Clean Slate Act, but we don't have much updates on that locally in Minnesota. But just again, another thing that sex worker rights are weaved into.
And you can probably see in these like claims and also like in our commitment to being like non-expansionist and people focused. Some of this is like we've just clearly seen the failures of the marijuana legalization movement to like adequately address racialized harm, like the disparities in how people are criminalized for marijuana, and it's like led to this is like a little crass, but like white people being able to start businesses, you know, while like Black and brown people stay in jail. And so that is not the aim of our movement. Our movement is to end violence and improve equity in our community.
Yeah, and usually folks like at the end of stuff, we are happy. And even after this, like if you think of any myths that we should be busting, if there's something in particular when you're working with your clients, like what could I say instead of this? Is there any clarity around things if we have a future discussion? And what would be just most helpful for you if we ever come back, I suppose? Anything with 1 minute.
I just want to say you're definitely welcome back anytime. Thank you so much. I just wanted to read a couple other like love notes in the chat.
My
Marissa said,
email's on the next slide. Aegor, can you move to the next slide? Sorry, thank you.
oh, no worries. 100% sex workers grew harm reduction and continue to. And then Jolinda also mentioned, I think this is such a beautiful statement of living in the gray. So much of harm reduction lives in the gray. Oh, and I was going to ask you, did you mention, did you have a list of some other resources? Just like if folks want to do read up and are interested in expanding on this? Great. Okay.
I have a book list that I'll send to you, Lindsay, if you can get it out to other people. Okay, perfect.
Great. Thank you so much.
Yes. Oh, those are great comments.
Yeah, thank you all so much for like taking the time today, and we're just like excited to continue to be in community with you. Yeah, really appreciate it.
And I will do my absolute best to respond to you within a very reasonable time for any follow-up care, anything.
Mhm.
All right, well, thank you so much again. Thanks everyone for being here today. I'll make sure to get all information out to you all after this session. I hope you have a beautiful rest of your day. Thank you.